afternoon. My name is Saida Gonzalez, and I'm doing this video on how to administer an intramuscular injection. Before I start, I just want to point out these are all the stuff that I'm going to be using along with my medical record for my patient and the medication that I'm going to be administering. In this case, it's going to be the flu vaccine. Okay, and these are all the nursing implications and all the stuff that I need to consider for my patient. First thing I'm going to do is I'm going to go to my patient's room. I'm going to knock. I'm going to introduce myself. My name is Saida Gonzalez, and I am going to be your student nurse today, and I'm here to administer an intramuscular injection per the physician's order, okay? And I am going to wash my hands, okay? And before we can even start the procedure, I just need to verify my patients using two identifier, and in this case, the identifier is the name and the date of birth. So what's your name? It's Anna Pawlowski. And what is your date of birth? It's May 5th, 1957. It's right here in the medical record. And do you have any allergies? And it's penicillin. The reaction on that is hives. Right now, I'm going to proceed to verify the flu vaccine against the medical record with the physician's order. So for Anna, I have a flu vaccine, and it's 0.5 ml. That's the dosage. The route is intramuscular, and the time is now. So that is something that you can see here on her chart. So I have done my first check, making sure that I have the right medication for the right patient. Okay, before I start doing anything, I'm gonna make sure that my patient is comfortable, that the environment is safe, that the bed is locked and it's the lowest position, that the rails only have two rails up. And if she has any questions or anything before we start, I just want to address that first. I want to explain my patient what am I going to do one more time. So basically what I'm saying is that I'm gonna give her a flu vaccine per physician's order. The purpose of this medication is to prevent the flu. Some things that I would ask her is if she has ever had this flu vaccine before, and if she had experienced any allergy reaction, and also if she has never had it, if she has any allergies to egg or egg products, some things that you might find in the flu vaccine. Okay, and also I need to make sure that she understands that the flu vaccine is something that you have to get every year to prevent the flu. So you're getting it now, and it's going to be good for this flu season, but next year you need to have it again. Some things that you might feel are a local soreness at the site of the injection, fever, myalgia, and possible neurologic toxicity. So those are the things that you need to look for. Okay. And now that I have explained it, intramuscular, which means it's in a muscle. Now that I have explained everything, I would close the door, the curtain for privacy, and then I'll start. Like I said, this is an intramuscular injection. It's given in one of the muscles. There are three different sites that we can give it. One is in the deltoid, which is the one that's on the arm here. The other one is ventrogluteal, which is on the upper part of your glute, on the back. And then the other one is the vastus lateralis, which is on the side of the thigh. For the purpose of this video, we're going to use the deltoid muscle. I think that's the most common one, and it's easier to inject. So that's the one that we're going to use. After that, I am going, if I need to make any calculation, I would do it at this moment. For this particular medication, I don't need to do any calculation. The order is very clear. It's 0.5 ml that I'm going to be drawing it from the vial right here. So I don't need to do any calculation. Okay. After I'm done with that, I'm going to gather all of my instrumentation, which is already here, all of the things that I need. The vial, like I said, this is where I'm gonna draw my medication. I have alcohol pads, I have a gauze, I have gloves, I have my sharp container, which is this plastic box. It's gonna be done as my sharp container, where I'm gonna dispose my syringe and my needle after I'm done. This is gonna be my arm, and of course I have the needle and I mean the syringe and the needle. So because it's 0.5 ml, I'm going to be using a 1 ml needle, syringe, sorry. Hopefully you can see it. It's this 1 ml, and the numbers are very clear because I'm going to be getting only 0.5. So numbers are very clear and it's easy to draw. And the needle that I'm going to be using, it's the 1" 23 gauge for a deltoid intramuscular injection. You can use a 1" from 21 to 23, and as you can see it right there. So this is the one that we are going to be using, okay? Before drawing my medication, I need to do a second check, make sure that I'm gonna draw the right medication for the right patient. So again, I'm going to go to my medical record, and this is Anna Pawlowski. Her date of birth is May 5th, 1957. She has allergies to penicillin, and the reaction on that is hives. This is not penicillin, so we're good. And for Anna, we have an influenza vaccine. We have a 0.5 ml that is going to be given intramuscular to prevent the flu, and the time is now. So I have done my second check. Make sure that I'm giving the right medication to the right patient. I am going to wash my hands one more time, and I am going to start the process of getting the medication. Like I said, this is the vial that I am going to be using. The first thing I'm going to do is check the expiration date. Right now, this is not expired, okay, which is good. And then the next thing I'm going to do for the purpose of this video, we're going to pretend this is the first time I'm opening this vial. And since this is the first time I'm opening the vial, I have to label it with the date, the time, and the initials, okay? I already have my label right here, so I am going to label it. And now what I'm going to do, date, time, and initials, I am going to take the cap off, okay? And I'm going to take my alcohol pad. I'm going to open my alcohol pad, and I am going to clean that rubber part. I'm going to clean, making sure, you know, there are no microbes and stuff like that. And I'm just going to leave the alcohol pad on top as a reminder that I cleaned it. Now what I'm going to do is I am going to open my needle and my syringe. I'm opening, and I am going to insert my syringe into the needle right there. Okay, and there you go. I have my needle. So when we are doing a vial, I need to draw as the same amount as medication as I need, but air, meaning that I need 0.5 ml of medication, so I need to draw back first 0.5 ml of air. And that's what I'm going to do now, and I'm going to be showing you. I'm going to go down, 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 down. All right, so I have, if you can see it, it's 0.5 ml of air, okay? So now, I'm going to take my alcohol. I don't need my alcohol anymore. I have my vial, okay? I have my vial, and now what I'm going to do is I'm going to uncap my needle using the rainbow technique, like that, and I'm gonna leave my cap right here, okay? So now what I'm going to do is I am going to insert this needle into my vial, and using air to air, which means that I am going to insert the air into the air part of my vial. So I'm gonna do it right here. Insert. Hopefully you can see it. My needle is not touching the solution, and I am going to insert that air. Okay, now I am going to invert it, and I'm gonna do this, and then I'll show you. and I am going now to draw 0.5 mLs of my medication. Okay, so this is the tricky part, because many times we can encounter bubbles, and it's normal. So 0.4, and maybe I can draw back a little bit more than 0.5 just to help myself to get rid of all those bubbles. I think I have a bubble right here, so I'm going to go back, and then and getting rid of this bubble. Sometimes it's a little bit tricky, so I just have to tap, 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 tap until you get rid of those bubbles, because you don't want your patient sometimes you have to go back and forth, but I think I got it, and I'm going to show you. All right, so now that I got it, I'm going to take it. I don't need this anymore, and I am going to do one hand scoop technique. Scoop. There you go. And let me show you. I have 0.5 ml of my medication. Hopefully you can see that. I have 0.5 ml of my medication. Now that I have my medication, I have to label this medication with the patient's name, the medication, the amount, which is 0.5 ml, the date, the time, and the initials of the person that's doing it, which is me. I have my label here. Okay, and I have it. So now I am ready to go and administer this medication to the patient. Okay, I would go to the patient's bedside, and I am going to use my medical record, my chart right here, and I am going to ask the patient, or identify my patient using two identifiers, which is Anna Pawlowski and the date of birth, May 5th, 1957. Do you have any allergies? That would be penicillin, and the reaction on that is hives. So for Anna, I have an influenza vaccine that it's 0.5 ml. It's given to prevent the flu. The route is intramuscular, and the time is now. So I have done my third check on Anna, making sure that she is given the right medication, giving the right medication to the right patient. Okay, so I have my medication right here. Alrighty, so now that I have that, I'm going to clean my hands. And I'm going to put my gloves on. I'm going to put my gloves on. My gloves on. Okay, now that I have my gloves on, I'm about to have my gloves on. Like I said, this is the arm. This is the arm that I'm going to be using. Just pretend that this is like the shoulder area and the arm is going down. I'm going to instruct my patient to relax and have the arm, like, you know, hanging on the side like this. And the way that I'm going to be injecting it, it's like I'm going to have these two fingers, my index and my middle finger, and I am going to have them like in a V shape like this. And from the acronym process, which is here, I'm going to have 3 to 4 fingers down, and then you're going to see that there's like a space right there, and somewhere in here in the middle, that's where I'm going to be injecting my medication. All right, so if I have my own I would put my 2 fingers like right here, and then 3 fingers down, somewhere in between, right there in that muscle. That's where I'm going to be injecting. Okay, so what I'm going to do, it's hard when it's not a real arm. So like I said, it's somewhere in between, maybe where the tape is, right there. So I am going to open my alcohol pad, and there I'm going to start doing cleaning the area, doing circular motion going outward like this. All right, so now I have cleaned it. I'm gonna let air dry, and I'm gonna use one of the corners of my alcohol pad, and I'm gonna put it like here or maybe on top. It doesn't really matter, but I want to do is I want to point to the area that I just cleaned, because it might be easier to forget which area are you cleaning. So that is just pointing at the area where I'm going to be injecting. Okay, so once it's air dry, I am going to be using the Z-Track technique, which is basically I'm going to use my non-dominant hand, and I'm going to be doing this movement. I'm going to be moving, like maybe rotating, say somehow, the patient's arm like this. And then right there where I'm pointing with the alcohol pads, that's where I'm going to be injecting. Okay, but before I do that, I need to open my needle doing the rainbow technique. Okay, and I am going to once more, I'm going to take my injection, my needle, and I am going to hold it as a dart. I'm going to go straight down as a dart, okay? I'm not going to think about it. I'm just going to go. If you go slowly, it might hurt, okay? So again, I'm going to use my non-dominant hand like this. Hopefully you can see where I'm going. And then I am going to inject. And then slowly, I am going to be injecting medication. Right, once I'm done, I'm going to take it the same way I went in, as a dart. I'm going to go out, release my patient's arm. I'm going to cap it. In a real world environment, you want to use your secure lock. Dispose of it for this video, since I need to use my my syringe. Then I'm just gonna recap it, and that's it. And then I'm gonna dispose of it in my sharp container. Every hospital, every doctor's office has one, so you just have to make sure that you put it on the proper box. All right, so I'm gonna be using my gauze at the injection site. Not a lot of pressure, just a little bit. You can also use a bandage if you want to. I'm gonna take my gloves off, and I am going to dispose of them. And then I am going to take all of my garbage, all of the stuff that I don't need. I'm gonna dispose all of them. My vials, since it's a multi-use vial, I'm not gonna dispose of it. I'm just gonna put it where it belongs. Okay, I'm gonna make sure my patient is comfortable. I'm gonna make sure that the cold light is within reach. The bed is in the lowest position. The bed rails, there are only 2 bed rails up, that that she doesn't have any questions or any concerns. And if everything is okay, then I would open the door, open the curtain, wash my hands one more time, and leave. Okay, and making sure that I monitoring my patient regularly. Okay, and that's it. That concludes my video of how to administer an intramuscular injection. Thank you.